Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Hello, Dr. Mencia. Good morning.
Hello, Anita. How are you?
It's a beautiful day today.
Oh, it's gorgeous. It's gorgeous.
And you are too, in your beautiful new suit and your beautiful tie and shirt. And I think people don't even want to come to you as a doctor. They just want to see what you're wearing. But don't get too hot now. Don't get too hot. It's hot outside.
It can get very hot outside, and that's a good topic for us because of the summer coming. And this is important because a lot of us in Florida, not only, for human, but, a lot of us have pets. And when we talk about heat stroke, people usually think of a human only having heat stroke. And you were just telling me you wrote an article for Boomer Times on heat stroke with pets. And it was interesting because I was thinking of talking about heat stroke in humans. So
we don't hear. Do you get people that come in as patients that they've had heat stroke, or how does that feel or look like?
Well, there's a full spectrum. For example, I had a patient of mine that incentivized the topic that the daughter went to the supermarket and left the 92-year-old mother in the car waiting for her. She didn't leave the engine on or anything like that. And when she went back in the car, the mother was kind of drowsy, confused. And she decided, let me go and drive by Dr. Mencia because mom doesn't look right. Maybe she had a little stroke. So she didn't tell me what transpired. I thought she's coming from home to see me. So I asked, did she have a fall at home? No, she was fine at home. So you telling me that you got her in the car and you came straight here, and on the way here that happened? And I said, maybe she had a TIA or something. And she goes, well, not really. I went to the supermarket. So she told me the story. I said, okay. So we got, some fan water, a little spray, and spray her body and took some of her clothes off and cool her down. And as soon as the temperature started coming down, we took her temperature. She was 99, which is, slightly high. But, a person, when they suffer from heat stroke, your temperature can go up to 104 or higher by definition. That's a full-blown heat stroke. So we were able to avoid the condition, give her cool water to drink. And usually, to treat the person, if we want to jump into treatment, is what we did with this lady. Move her to a cool ambient and then apply cool temperature. If you have a bathtub or a cool shower, the pool is no good because the pool can be hot. But a cool shower, cool water, you can put ice on the forehead and the neck and the armpit and the groin area, because that hit the core temperature. And then hydrate the person well. Now, why did she get slightly confused? Because once you suffer from heat stroke, your brain starts swelling, and you can go into a coma. And her temperature was just slightly elevated, so she was at the verge of going into heat stroke, and we were able to avoid it. Thank God that the daughter was, at that point, stupid enough to leave her in the car with the engine off and the window up, but smart enough to run for healthcare and bring the patient right in.
Just because I was going to ask you that, what would happen if someone is in heat stroke, and you just told us that they could go into a coma?
They can go into a coma. They can die. A lot of people, especially the elderly, if you have an animal and you leave a dog that is not a puppy, puppy can, but more advanced age animal, you leave them in the car with the engine off, you come back and you find your pet dead, they will die. And it's from, the swelling of not only the brain, but the heart and the lungs and the kidney. All those vital organs will swell up, and basically that's how the person or the pet will die.
Well, but if you and of course I would never leave my dog in the car, but if you don't leave the air conditioning on, even keeping the windows open is probably not enough either. It's probably still going to get pretty hot in there.
Well, in a car, the research have shown, and when I was doing the research for heat stroke to talk about the topic, it's interesting to find out, it was news to me, that if you leave a car when the temperature is really hot, it only takes 10 minutes for the temperature to go 20 degrees above whatever you are. So let's say you are in a car and you have the temperature at 74.
Excuse me, nowadays, though, the heat is in the 90s.
So outside. 74 in 10 minutes, that temperature inside the car is on. 74.
Okay.
You turn the car off, you walk out of the car, wait 10 minutes, it's going to be 94 in that inside the car.
And so that's too much for a dog because they're covered with fur
and remember, the car is designed to contain the temperature, not to get rid of temperature. That's why when you turn the air conditioner, it can be 90. You can put the temperature inside your car at 60 because it contains the temperature. So when it's hot outside and you turn off the car, whatever heat comes inside the car, it gets contained inside. So it can be 80 degrees outside, but your car can be 94 or 100 degrees inside your car. That's why it's so crucial we don't leave kids or pets or any living thing inside the car.
Okay, this is really important, everyone. Did you heard this? Now, people say, well, I want to exercise, so what do I do now? So tell people what they should be doing.
The most important thing, if you have a loved one that come from up north, come from Canada, is not accustomed to our temperature and our moisture, they have to be reminded that, acclimation is one. If you are not acclimated to the temperature, you are at high risk of heat stroke. So let's say you get somebody that coming from Canada and they want to enjoy the summer. They only have 3, 4, 5 days to spend here. The first day, as soon as they arrive, they just, put on a sweatsuit, what they are used to wear up in Canada, and they go to the beach to go for a walk to exercise because they want to lose weight. They don't take any water with them, and they start exercising. So the body temperature is going to start increasing, and they're going to start huffing and puffing as they keep doing this. And especially if they do it around noontime, that the temperature is the hottest. Those people are very prone to heat stroke. So people that come from up north that are not acclimated to our temperature here in Florida, they are at very high risk. And for those of us that live here now that are acclimated to the temperature, we have to remember to wear loose clothes, not to wear excess amount of clothes when we exercise. You see the cyclists, sometimes they go and, they wear the outfit, but it's more set for winter, not for summer outfit for cycling. And when you do that, and if you don't drink water and you just keep exercising, you can suffer from heat stroke because it's two types of heat stroke. There's the one that is induced because of hot weather, and there's the heat stroke that is induced by excessive amount of exercise. Mm-hmm. So either one of them can produce heat stroke. So it doesn't have to be that the temperature is 100 degrees outside. It's just that you are over-exerting yourself with exercise in a short period of time. And you add the temperature to that, you add the moisture to that, and those people, are at high risk.
I hadn't thought about this, but I remember when I was growing up, I lived on Miami Beach, and I went to the beach a lot. And I remember that there were people who the lifeguard had to resuscitate because they had heat stroke. I didn't know what that was at the time, but now I'm thinking about it, that people went like numb. They were out on the beach. This is a long time ago. And so it's
their body temperature can go above 104. For those of you that listen to us from Europe, we're talking about 40 degrees Celsius. They get altered mental status or behavior, so they can be confused, agitated, delirium, and they can even have a seizure, especially if they are prone to seizure or epileptic attack. They can have a seizure. They can even drift into a coma. And then what is interesting is about the sweating. If it is due to hot weather, you would think that the skin will be sweating a lot, right? The person will be, full of sweat. The skin is feel hot, but it's dry when it's due to the weather because it's the core temperature that is hitting you. If it's due to exercise, then the skin will feel moist because of you are exercising the body. And the person can feel nauseated, can even start vomiting due to the heat stroke. And the skin will flush, so it will turn red as the temperature rises. And then they start having that rapid breathing. So they start huffing and puffing. They think it's from the exercise that they are doing. And the heart start racing on them.
It's interesting that you should be saying this because we started talking about a dog, and of course everyone knows I have Snowy, and Snowy's sitting here on her little map, and we walk in the morning, and I should really go out at 7. A lot of times I don't do it. I get out at about 9 o'clock, and she'll do her walking, and all of a sudden she finds a big patch of green grass, and she sits down. Come on, Snowy, let's go.
And most people, what do they do?
Yeah, same thing.
They pull them.
Yeah, they pull them,
they
but let's go.
Down, yeah.
You're absolutely right. And I see that, so I let her sit down, and then she winds up lying down.
Right.
But I could see that her little tongue is out, and I could see her heart beating. So I let her stay that way for maybe 5 minutes. And then I say, okay, let's go, Snowy. Now, sometimes she'll get up and she'll go. If not, I pick her up, and I take her back. Because I'm feeling that's not normal for her, so she must know her own body.
Of course.
So that's what's happening, isn't it?
And it's better when they sit like that. If they want to lie down, just get a little bit of water, put it in your hand, let them,
I'll take water with me. That's a very good idea.
So that they can, rehydrate themselves.
Yeah.
And but when they sit, they are trying, the bodies, they listen to their body different from us.
And we have to listen to what they're saying.
Exactly.
It's an all new world having pets, and all right, well, now, one thing I'd like to encourage people, and we talked about it before the show, is if you want to exercise, and you should, go to the mall. It's air conditioned.
The mall is excellent place to exercise. If you want to really exercise, go for a walk. A lot of people that come from up north, of course, they want to take advantage of the weather and the heat and the sun. So they try to kill 2 or 3 birds with one stone, and they want to go on the beach and exercise and do all of those things. You have to let your body acclimate. The first day when you come from up north, go to the beach, go into the water, relax, take plenty of water. And then, especially early in the morning or late in the afternoon as the sun sets or the sun rises, that's the best time for you to go and exercise. Not at noontime when the sun is right on top of you and it's the hottest.
And a lot of times they'll have their grandchildren, so they go to the beach, they don't realize what's happening, and they should absolutely, they should absolutely do it. Let me just tell everybody how to get in touch with Dr. Mencia, because he is there today, of course. He's Saturday hours.
And the dermatologist is there today.
Dermatologist
and
is
dental
there.
department
and
is there today.
Dental department, always. They're just such a great job. Okay, you're going to call them over there if you want information or you want to make an appointment. But actually, you don't have to. If you're having a problem, just go there and they'll figure out how to see you. Their number is 954-489-1345. That's 954-489-1345. And if you want an appointment over at their gorgeous Boynton Beach center, you can just call that. Well, I'm just going to give the one number, and then they'll call, and because I know you're not open on Saturday there. So it's 954-489-1345. Now, something we haven't talked about for a while, home visit services are available for homebound patients.
Homebound patient.
And what is a homebound patient for you?
It's a patient that either suddenly or chronically is unable to go out of their place of living and go to the restaurant, go to the store, go to a doctor. Usually, and those patients where they neglect themselves or are neglected by others, they basically end up going to an emergency room and getting hospitalized and then going to a nursing home. And the reason a lot of these people are homebound is because they don't want to go to a nursing home. They're not ready for that. They still want to live at home as much as they can. So we try to work from the medical point of view and trying to approach it from the psychosocial medical aspect of care. Go to that patient, bring the visiting nurse or the social worker to make sure that if they need meal on wheel, if they need a companion, we work with Senior Helping Senior and other organization that will go ahead and bring a companion to go there. And then from the medical side, we have the nurse practitioner, we have Dr. Richard. So, we have doctors and nurse practitioners that will go there and nurses.
And people in dental work, too. Let's not forget that, because that's really important. Nobody does that.
Even my dermatologist had, been kind enough to go and see my patient at home. If there is something that we feel that we need more than just the care we can provide. So,
and you said today the dermatologist is going to be there at your practice.
The dermatologist there today.
On commercial. I know I'm not responsible for it in a way, but I did tell you this story quite a few years ago, that for me it was terrible when here I know so much and I couldn't get anyone to come when my mother was in her bed. She had Alzheimer's of the Lewy body kind, and I didn't know what I was doing, and I couldn't get her. She was, like in a fetal position, and I begged the doctor to come at the time, and he couldn't. I finally had to beg him enough and pay him. So I'll pay you anything. You've got to come see my mother. And at that point, he did come, and is when he said to me, Anita, your mother's in very serious condition, and she needs to go to hospice. She's filled with water. I wanted to cry. That wasn't right, Dr. Mencia, and that's what. There must be millions of people at home in the same situation, and that's why what you're doing is like a miracle. I can't thank you enough for doing this.
Well, being a geriatrician and being an internist, there are many young people that, unfortunately, because of either medical condition or accident they have had, they are homebound. And so we take care of those young people as internists. But also as a geriatrician, then we cater and take care of the elderly that cannot come to see us at the office. And, sometimes our patients that have been coming to a doctor's office all along, and they know they cannot drive anymore. They know that cannot go to that doctor anymore. And that's the time to give us a call and say, can you guys come to my home and see me? And you don't want to neglect yourself. Don't let it go too far. Don't put your head in the sand. Do it early. Take care of yourself early. And, now we have the hurricane season starting. And we are basically responsible to make sure that if anything is coming down our way, that those people are taken care of, that they get taken, to a shelter. So, there's so many things that we get to do, and your loved one might not even be in Florida. It might be who knows where. And, we are there to support and care for you.
I know you are, and that's why you have all the various
services.
Services and staff members. I mean, if a person came in and just said, I'm having a problem, I can't get this, it has nothing to do with medical. They're going to help you because that's what Dr. Mencia's whole philosophy is. He's here really to help people.
We have one patient that the daughter came to visit, and she called us to do home visit. And I don't recall how she found it, but she called us to come she was looking for a geriatrician. And the American Association of Geriatric Medicine gave our name. So she said, I don't know how to get my mother to see you. I said, no, we do home visit. We'll come to you. So she thought that we are a home visiting company. I said, no, we have a center. So she came to the center, she saw it, and she had lost so much weight. I said, what are her teeth? And she goes, I don't know.
Of course.
So she lost her teeth, who knows for how long.
Of course.
So we brought dental department in. We took an impression. We did denture, upper and lower denture.
Oh, that's
we
wonderful.
Brought her denture back in, and then we started, get the nurse to come and see her and the physical therapy because she decompensated so much. And just putting the teeth, we didn't need to change medication. We didn't need to do anything different. The lady takes just vitamin and something for her thyroid. And just putting her teeth back on, she started gaining weight and got back on her feet.
But I don't know of another organization that is medically, it's primarily medical, and now you've added the dental, and now that's becoming equally as efficient and well thought of, but that you can go in not just for the homebound patient for health, but for dental, to be able to have dentures fitted at your home is incredible. I am so thrilled to hear that story.
Yeah.
That's really, as a matter of fact, I think after we are going to have the orthopedic surgeon who was just here, Dr. and I don't remember his name, I'm sorry.
Dr. DeFranco.
Yes, DeFranco.
Michael
Thank you.
DeFranco.
Yes, he's going to write the article for July. But for the next one, it might be very good to talk about the services at home and all that you do with the dental, with all the kinds of things, because people need to see that. It's the boomers that need to see that because they can't get their parents or their loved one to the doctor. They can't. They don't have time. And you know what it takes. Imagine this. Someone wants to come to see you. So the daughter or son arrives there. They have to get the person cleaned up, dressed, into the car, just getting into the car and then getting out of the car. It's a big deal.
Well, no. I mean, reality is that you get them cleaned up, you get them dressed, you get them in the car, they have a bowel movement, you have to get them out of the car.
Oh, that's it. You did it. No, you
have
did
to
it.
Clean them up.
Because that's why they don't want to go anywhere.
Now they are late for the appointment. Now they don't know what to do.
No, it's like so true. And people are sitting at home saying yes, because it's like, I don't know if I'm going to have my bowel movement now. I better wait.
Right.
That's why people don't go out, or they're incontinent and they can't go. You hit it right on the nail on the head.
And, being a geriatrician, I mean, I take care of a lot of young people. But, with my geriatric patients sometimes, and they're so apologetic. They come in and they say, "Oh, Dr. Mencia, I'm sorry. My appointment was at 10. I know it's 3 o'clock. But I'm so happy you can see me. I hope, you are not upset." I said, "No, I will never be upset. But that's usually the hint to me that something is going on.
Yes.
That they couldn't keep up that 10 o'clock appointment, So I just start talking to them and offering the service and say, "No, we can come to your home when you cannot come to us. We can go there and see you and help you out."
You're going to love this story. And of course, Bill doesn't listen to the show, and that's good. Talking about Bill. Because Dr. Mencia really helped him with his constipation. So now Bill's really good. He takes his prunes. He does it. So we're doing our walking with Snowy. And all of a sudden, Bill said, "I think I have to go back." So I said, "Okay, I'll go on." He said, "Yeah, I think nature's calling me." But he is doing terrific. He's regular.
Beautiful.
You're that little thing that you did with the prunes. It seems so stupid right now. Listen, anybody, if you're having a problem with constipation, eat prunes.
Eat prunes.
Eat prunes, I mean, he has his little prunes. He I only get him the best, though. I go and I get him organic prunes.
Good.
And he eats them. He takes his fork and he sits and reads his newspaper, has his prunes. It's perfect.
Yeah.
So that was the
and
kind of thing.
Yeah, we have. It's a natural ingredient.
Oh, my goodness.
We believe how time flies.
No, but we're having so much fun, and it's good. So we told people about homebound. Let me give you your phone number again. It's 954-489-1345, and you can actually get on their website, which is AGIFL. That stands for Adult Geriatric Institute, but it's AGIFL.com, and you can just go down and see Dr. Mencia and the dermatologist and dental and everybody you need. You're there.
And Dr. Trentali, he wrote a nice article.
Oh, it was
for
beautiful.
This edition.
Wasn't that great? I loved his article on being a podiatrist.
Exactly.
And what happens to people.
And he does home visit. Dr. Trentali who does home visit.
This is it. You have really accomplished something that most people haven't done, and I'm so proud of you and so proud to be involved with you. I just talk about you all the time.
Thank you.
You're welcome. And have a great Saturday, and we will see you next week.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.